Welcome to Ready to Talk, Ready to Listen, a podcast about all things mental health. CHE Behavioral Health Services interviews guests as they discuss relevant mental health topics and speak with our industry's top leading trailblazers. Let's get started discussing behavioral health and ways to support our mental well-being.
Hello, Michael Lawler here.
And Lucy Janoyan. We are the co-hosts of the Ready to Talk, Ready to Listen podcast, where we feature top industry experts and those interested in behavioral health care and mental well-being.
Today, we have Dr. Jeremy Weiss here of Rise 25, who has done thousands of interviews with successful entrepreneurs, investors, CEOs, and we have flipped the script, and today he'll be interviewing us.
Thank you both for having me. I am really excited. This is going to be a great episode, and everyone needs, in the world today, what you guys do. So I can't wait to introduce this. Before we get into it and dig into it, this episode is brought to you by CHE Behavioral Health Services, and CHE offers comprehensive mental health care solutions, including in-person and telehealth psychology and psychiatry services. And we all know this, right? Americans are experiencing greater stress, anxiety, and depression more than ever before. And that's what your mission is. CHE's mission is to provide access to care and support individuals to improve their quality of life and emotional well-being. And you have over 850 professionals committed to providing the gold standard and evidence-based behavioral health care. You can learn more about CHE or book an appointment. You can call them at 888-831-2618 or visit cheservices.com. So I wanted to start first with Michael. Why don't you tell people a little bit about CHE and what you do?
Absolutely. Thank you, Jeremy. What's really great about CHE is we've been here providing active care for over 25 years. And the company, with all of its providers, has focused on one thing and one thing first, which is behavioral health with a patient-centered focus. And our patient-centered focus evolved out of the residence-based care for our senior and elder population. But over the years, we realized a large, broad population of patients were experiencing various challenges and difficulties. And it felt really natural for us to take our experience and our depth of knowledge and bring it to the general public. And that's what we do today. We have sites of care where we provide patient overview and development in the form of residence care, in-person care, over telehealth or via video solutions. And we continue to expand that for both psychological services and psychiatric services, depending on the patient's needs.
And tell people a little bit about Lucy, Michael.
Sure. I'm really proud to highlight Lucy. So Lucy is our Chief Operating Officer of the company. She has 20 years of extensive healthcare experience in a variety of settings, most recently over the last 6 years with CHE, focusing on developing our operations and our sales efforts. Her depth of experience brings a real wealth of opportunity for our company because she leads and guides the clinical team as well as the field operations team to ensure that we have really top tier gold standard care for our patients.
Everyone knows if the operations aren't working, everything comes to a screeching halt. So Lucy, tell people a little bit about Michael.
Absolutely. Well, I'm actually very lucky to be a COO and partner with Michael Lawler. He is the Chief Executive Officer for CHE and came to CHE about 4 years ago with extensive executive and senior leadership experience in healthcare industry, ranging from DME to radiology, imaging, and oncology sectors. And Michael brings compassionate leadership to our organization, and he's really brought the team together, both from within and hiring talent from outside the organization. We really believe and support his vision for CHE, which is really about patient care and clinician first, clinical focus, and providing that holistic approach to mental health and behavioral health service delivery. And I'm very excited about the future of CHE and where we're headed. And that's all thanks to his leadership of our organization.
Michael, I wanted to start there, which is I know there's all like multiple behavioral healthcare platforms out there. They do a variety of things. Can you talk about CHE and where that fits in the spectrum?
Yes, it's been intriguing to me that there's been this evolution of access for behavioral health solutions and access for patients to care. And in some cases, it's done really well. In other cases, the access has been limited. We all know that, young Americans, elder Americans struggle with all of the behavioral health and mental health illnesses that are out there. We also know for years it's been taboo or it's been difficult to get access to a clinician or a provider who can help you with your needs. I think what CHE brings is this 25-year experience of clinical care. And we bring that in an environment where the patient is most comfortable. So whether it's in the comfort of their home by way of a video chat, whether it is in an in-person setting at one of the possible solutions we may have, or a variety of other mediums, we try to find the fitting for the patient and the provider where they're most comfortable. And I think what's really unique about us is that we bill virtually every insurance payer out there. So from a patient's perspective, this is easy access to care with a great solution with a provider. And ultimately, it comes to you under the comfort of your current insurance coverage.
That's probably a lot of the first questions people ask is, you probably help a wide spectrum, but also how do you accept payment, right? Because they're worried about that. So that's great to know. And I wanted to talk either for you, Lucy, or Michael, is what's a provider makeup of the organization?
Lucy, why don't you share that?
Sure. So we hire licensed therapists and really doctoral level providers, as well as master's level providers, psychologists, licensed clinical social workers, licensed marriage and family therapists. And we also hire psychiatrists as well as psychiatric nurse practitioners. And most people don't know the difference. Well, the licensed therapists provide what we call psychotherapy. So it's talk therapy, and that's by way of either video or in person. And the psychiatrists and psychiatric nurse practitioners provide medication management. So they can prescribe medications, they can manage that over time based on what the patient needs. And it's all really driven by the medical necessity. So we do have the medical model, and it's very important to us that there is medical necessity. Our approach is really first non-pharmacological approach, and then after the assessment, then the patient will be referred to, if needed, a psychiatric nurse practitioner or psychiatrist for that. So that is really the difference of our providers. And we have a wide range of clinical modalities that we treat.
Yeah. And like we will talk on another episode about the type of things that you treat. And so check out another episode for that, with about the patient care. What are the things that you provide, the different services, and also the treatments, as well as, the actual categories that you help people with, like anxiety, trauma, depression. We'll get deeper on those. But what I wanted to talk about with this one is, you're expanding. There's a lot of people that clinicians are loving working there, and why they're loving working there, and some of the success behind the growth.
It's been really interesting to me and exciting to me to follow our providers' kind of growth in the organization. And what makes the company different in many approaches is simply this. We seek to find really talented providers, those clinicians, whichever their discipline of focus has been in the behavioral health space, and allow them to craft a patient care based upon the individual patients that they're working with. And so the providers really enjoy that. And they enjoy that because they get this chance to build the relationship with the patient. The patient gets a chance to fit very well with the provider that makes them comfortable to talk about their challenges. And at the end of the day, the providers themselves can set their schedule. So we have patients who are coming into CHE through a variety of methods, including social media, via our website, or they hear about us through the general public. And then we match them to the provider that fits them as best as we possibly can. And they get a chance to have a trial session and then determine based on that session where their care would go.
Last question. You have a lot of clinicians and other people applying to work there. And I'm wondering if you're talking to someone now, someone considering working there, because I know you turn a lot of people away because of the credentials. You want to make sure they're experts in their field. Someone's considering working there. What would you tell someone who is thinking of, should I apply to, work there or not?
To me, the biggest piece for a provider, I think, is making it fit into their work-life balance. And for us, it's an ability to offer a full employed relationship that we help develop that provider's capabilities over time. We have full internal CEU training, which is continuing education. We offer a huge benefits package for them. We offer paid time off as appropriate based on their needs. We have a hugely competitive compensation package. And as I mentioned earlier, this ability for them to build their own work-life balance, to see patients as they feel available, really works. Our goal is to be the employer of choice for clinicians in behavioral health today. And I think we've done a very good job up to this point.
First of all, I want to thank you, Lucy. I want to thank you, Michael. Everyone should go to cheservices.com, learn more, check them out, and check out more episodes. Thanks, everyone.
Thank you
very much.
Thanks for joining us in this episode of Ready to Talk, Ready to Listen, all things mental health. Click to subscribe to our podcast on iTunes or Google Play. Until next time.